Inyo County and Mono County launch 211 live call centers. The county of Inyo and Mono County have implemented a new text and live calling platform for residents in both counties. 211 is the go-to public phone number to get accurate information about COVID-19. The number has both English and Spanish-speaking people on hand to answer callers. If you live within the boundary of either county specific to that county and have a question that you need answered, you can call 211 or text 211-211. You can expect to hear from a live person at the 211 call center. Calls will be answered at all hours of the day, every day. The call center staffs have constantly updated local information from Inyo County officials and Mono County officials, and they can get you the latest information whenever you need it. Bilingual staff are available as well. 211 is a partner in emergency response, providing reliable and accessible information during rapidly changing conditions. Both Inyo and Mono County are committed to keeping the public up to date with the most accurate and timely information. All COVID-19 updates and press releases can be found by visiting inyocounty.us/COVID-19 or coronavirus.monocounty.ca.gov. Visit sierrawave.net for the latest news and information. During our Monday telephone conference call with Dr. Stacy Brown, the director of the Northern Inyo Hospital Rural Health Clinic, we caught up with the latest number of COVID-19 cases in Inyo County, which, as we have said, have already changed. Some good news shared by Dr. Brown is that the hospital is now going to be getting LabCorp coronavirus lab test results from Phoenix, Arizona, rather than waiting for up to 7 days or longer from labs back east. The new setup should allow for test results within just 2 to 3 days. And in another bit of good news is that NIH already owns a high-tech machine called a Cepheid Expert Express SARS-CoV-2 test. Quite a mouthful. It's been recently approved for use by the Federal Drug Administration. This rapid molecular diagnostic test can detect the presence of the COVID-19 virus that causes the coronavirus in 45 minutes. Dr. Brown expects the machine to be approved for use by mid-April. The new test will not be used on the general public, but will be restricted for use with essential workers first, such as hospital workers and so on, and then vulnerable populations second, people with diabetes or other chronic medical conditions. For the general public, Dr. Brown said, "We're taking a new approach. If it looks and smells like COVID, it is probably COVID. So we're not going to use those tests on the general public. We're saving the tests for healthcare workers, first responders, and critically ill patients. They're our number one priority. Next would be high-risk individuals like people with underlying medical conditions and older people." Antibody testing is expected to become available soon across the country, which will be helpful in sorting out those that already had COVID-19 and hopefully built up an immunity to it. Brown expects a surge to happen in the very near future. He says that the hospital is doing everything it can to prepare. Looking ahead, Brown says we're looking at a surge plan for when things get much busier. Right now, we are well within our capacity as a hospital. Dr. Will Timbers, who works in the emergency room at NIH, said that the general public is doing a great job of staying home. In doing so, he noted, there has been a lessening in the number of viral cases and also other acute injuries not related to the coronavirus. Timbers says that the community should be commended for staying home. Basically, by doing so, there has been a lessening of the workload on the emergency room, having to handle acute injuries and freeing the focus to be kept on battling COVID-19. Town Hall for Inyo County residents on COVID-19. Well, that's a new idea that's being tried out in an effort to keep Inyo County residents as informed as possible regarding the unified command approach to COVID-19. While simultaneously maintaining certain distancing measures, a virtual town hall meeting has been scheduled for April 9th at 6 p.m. Subject matter experts from local hospitals, public health, Inyo County, and the City of Bishop will be available to brief the public on coordinated response efforts as well as answer questions. To participate, click on the following link, zoom.us/J-2859-18184, or again, just visit our website at sierrawave.net for that information. And we'll be right back with the weather.